the majority of people that have a mental health issue don't get treatment for it. That's a very significant problem.
Now at 5, just how accessible is help for people with mental illness? Good evening. It's a question raised after our exclusive interview yesterday with the wife and mother who's trying to make sense of her son's death.
Her adult son attacked her husband, his father, who says he was forced to shoot his son to survive. She also said her son was addicted to drugs and may have had other mental issues. Tonight, we continue our coverage with News Channel 15's Alyssa Ivinson. So what can people do if they're suffering from a mental illness?
Well, I found out today there are several different resources available around Fort Wayne and the area, but the hardest part can be getting people willing to accept the help.
Suffering in silence.
Generally, people stay quiet about it as opposed to actually talking about it and asking for help.
Mental illness can be devastating, but there is hope.
Treatment can have a very profound and valuable impact and leave people with lives that are more full and happy.
Mental health treatment doesn't always mean years of therapy. Some people see a benefit in just a few sessions, but the biggest hurdle is still just taking the first step to get help.
It's a need that's been under-addressed by the overall community, and I think that's to a large degree because people are concerned about the stigma of mental illness. They're embarrassed about it, and so they often don't seek care when it's available.
Simply talking about mental illnesses, including depression and anxiety, can help break that stigma down. Park Center helps 7,500 people a year, but still.
There's a problem in that the majority of people that have a mental health issue don't get treatment for it.
For some, they think help isn't accessible, but there are services available and ways to help people pay.
Our goal is to never turn somebody away because they don't have the resources.
But unless a person is a danger to someone else, no one can force someone into treatment.
It's an issue of patience and support and continuing to urge people to get help.
Most insurance companies do cover mental health treatment, and a lot of centers in Fort Wayne, I was told today, operate on a sliding pay scale. So really you pay kind of based on your own situation to help make getting help more affordable.
Okay, thank you, Alyssa.